For the life of me, I didn't think that it was very serious. And 2 days later, the results came out positive. And she told me, and I was shocked. So I have this habit of doing self-examination of my breasts after every cycle of menstruation. So it was at the beginning part of June when I realized that there was a sizable lump in my left breast. My daughter actually insisted that I should go for a checkup. Like, are you sure? Like, is this a mistake? What's going to happen to me? What's going to happen to my daughter? Is she going to be left without a mom? Who's going to pay for all? How much is it going to cost me? What is it? Am I going to die tomorrow? Because my knowledge of cancer was very limited at that point of time.
Then I had a phone call from her, and I just couldn't believe that something so sad could happen. She was like my pillow was dragged.
So when she first broke the news to me, and it was over a coffee at a cafe, so initially there were a lot of questions on our mind, like what's going to happen next and the cost involved. So I think I was the more rational, or like I want to give her very concrete things to consider.
For Azriza, first of all, she's young, okay, and most of my younger patients would prefer to conserve their breasts. Having said that, even our older patients would also like to conserve their breasts. Number two, her tumor was small, so we were able to offer her breast conserving surgery, which just means that we remove the tumor, but we're able to retain the rest of her normal breast. And this way, she doesn't need to do a mastectomy, which is removal of the entire breast, because some patients can find this to be quite disfiguring. Thirdly, the good thing for her is that tumor hadn't spread to other parts of the body, so it didn't invade the skin or the chest wall, and so she was suitable for breast conserving surgery.
I remember the first time when I met Dr. Michelle. So she said, "Hi, Azriza, how old are you? And how's your chemo and all that?" So she did all the, the context. She set the context and all that. And then she fished out a blank paper, and then she started stating, writing all what radiotherapy is all about. And then there's a toy, if for lack of a better word, a toy radiation machine, right? And then she actually showed me how it works. I thought that was helpful. She went through the side effects, so that was helpful. That gave me confidence. Dr. Michelle, I trusted Dr. Michelle. She knew what she was talking about. And I decided to go ahead with the radiation therapy.
So Azriza received daily radiotherapy. So this was given to her every day, Monday to Fridays. So 5 times a week over 4 weeks. In total, she had 20 sessions. Now for Azriza, her breast cancer was on the left side. So for all our left-sided breast cancer patients, because the heart is on the left side, we do employ specialized techniques to help to reduce the dose to the heart. So one of the techniques that we use is called active breathing control. So in active breathing control, we will actually teach the patients how to take a deep breath in and hold it for about 30 to 40 seconds. When patients take a deep breath in, their heart actually moves away from the chest wall and out of the radiation field. And in this way, we're able to reduce the dose that the heart is receiving to close to zero.
What really calmed me down is the skylight, and I felt that I was in a plane. That year I didn't go traveling, so this was my form of like very nice. Yeah. I noticed that the staff are all females. I appreciate the fact that ARO has all female staff. And the therapies were very reassuring. They were very positive, and everything is like, good, you are doing well. I think it's very important for patients like me, even when, during the times that I really couldn't hold my breath the first few times, they say, it's okay, we'll try again. So I really like how the therapists actually handled me, I also liked how they protected, although it's already all female staff. I also liked how they protected my modesty. They were very careful with my breasts, and they always have them covered. Dr. Michelle was very genuine with me. I think she cared about me and her patients, yeah. And then we had a chat about family, about holidays. I really enjoyed, having the chat with her. So with Dr. Michelle, I don't have to pretend that I'm okay. It's the diet, it's the exercise, and it's also the positivity, the outlook on life. I make sure that I exercise. I think this is the single most important thing when you are dealing with cancer. When I was diagnosed with cancer, I stopped working for a while, and I used the time on myself to exercise. I walk a lot. I am more conscious of what I eat.
Azriza, every time I hear her name, I think it just brings a smile to my face, because to me, I felt that she was really quite special. I usually see my patients who are on treatment once a week, and I always look forward to meeting Azriza. It wasn't, whenever she walked in, it didn't feel like a formal doctor-patient consultation. It almost felt like I was just conversing with a good friend. And of course, although we didn't know each other before this, it felt like, we'd been friends for a long, long time before that as well. I always felt very comfortable with her, and I believe she felt comfortable talking to me as well. And I was always very encouraged, every time I met her.
I really just want to congratulate her, because this wasn't an easy feat at all for anybody. And for just to see her do it with such grace, I think it's really inspiring for me, because I really saw it behind the scenes and everything. Yeah. And I wanted to really thank her for finding the time to be there for me when she wasn't doing so well. Yeah, I'll hold it very close to my heart.
I was very amazed, at her recovery process also. I really, really say that she's superb and she's so brave. Yeah, and so full of courage. Yeah, and I could see like throughout the whole time, her joy and her spirit was up. Yeah, and I think that helped her, and also helped her family members and her friends around her, because she's such a constant joy to be with.
I feel that it's a blessing because, I believe that with every hardship, there are many ease that will come your way. Okay, so I take heart, that everything is going to be okay, right? Good things will come out of this hardship. It's a trying season of my life. I'm happy, despite the trying months before. I'm happy with what I am. Grateful. I'm grateful that I have this time to meet a lot of new people.